Of Gauteng, David Makhura says his office has been hard at work to prepare for the months ahead. He says the Easter weekend is worrying and the winter season will bring its own challenges. The Provincial Command Coronavirus Council has been giving an update on the COVID-19 pandemic in Gauteng.
There are important things that are worrying us. We are moving towards Easter. The Easter weekend is a weekend where large number of people move out of our province, so the level and extent of mobility, increased mobility is always an important risk factor with regard to the spread or the potential spread of COVID-19. The infection rate, its relationship with increased interaction amongst people and mobility. So we are getting to the Easter weekend. So the Command Council has been looking at what that might mean, but we are also moving to winter. So there's two, at the backdrop of this is the Easter weekend, and we are moving to winter. And again, during winter, we ordinarily worry about the flu season. And our teams, our health teams, have also been reviewing what they normally do during winter. They do immunization, flu immunization during winter. They looked at what we did in 2020. There are also other immunization programs, but we also extensively looked at the real vaccine rollout. The extent to which our province is ready.
Gauteng's Provincial Coronavirus Command Council says the second wave of COVID-19 infections in the province was not as bad as the first.
Gauteng seemingly we got off a little bit lightly compared to the other provinces. The second wave was not worse than the first. And I mean, one of the reasons that we think accounts for this is because by the time the level 3 lockdown, alert level 3 was implemented, it was a very timely implementation of public health and social measures. So the rate at which the second wave was going, our conclusion is that if that level 3 had not been imposed, perhaps we would have seen an even worse second wave. So that's some good news that we're seeing there. So, and there are obviously, since the lockdown level 3 has been implemented and we're now in lockdown level 1, there's been adherence to public health and social measures, mask wearing, and masking was now a mandate. And so that all contributed to a reduction of the second wave. So we're now in the post-wave phase after the second wave. So the last thing I want to say on this slide is, even though we're in the post-wave phase, the current post-wave phase is still, the numbers we're seeing are still higher than the ones we were seeing in the first post-wave stage. So the numbers of cases, the numbers of deaths, particularly the cases, have not gone down to the level that we were before the second wave started. And one of the other things we wanted to note, which I'm going to talk about perhaps in the next slide please. The other thing I want us to note is that when you look at this current post-wave phase, for the last 8 weeks we've been tracking weekly number of cases of COVID-19 in the province. And for the last 8 weeks we've been seeing a downward trend. But then the epidemic week ending the 13th of March, there was an upward trend for the first time in the last 10 weeks.